My name is Matt Elias, and I'm a pediatric cardiologist at the Children's Hospital of Philadelphia. Now, I'm frequently asked if children should be vaccinated. There's honestly no hesitation in my answer. Absolutely yes. Everyone who's eligible for the COVID-19 vaccine should receive the vaccine as soon as possible. I say this as a cardiologist and as a father. Since the beginning of the pandemic, we've seen that COVID-19 can impact the heart in a variety of ways. And children are sadly not spared from these heart issues. I've personally seen otherwise healthy children become extremely sick when infected with this virus, including those with myocarditis and heart failure. Myocarditis is not a new phenomenon. Myocarditis is another term for inflammation of the heart muscle and can be caused by many different viral infections, including the virus that causes COVID-19. We've been treating myocarditis long before the pandemic and long before we ever heard the word COVID. Even if children have no symptoms or only mild symptoms with the initial infection, they're still at risk for the post-infectious condition called multisystem inflammatory syndrome in children, or MISC. This syndrome occurs about 2 to 6 weeks later after the initial infection, and children are often critically ill, admitted to our pediatric ICU in shock with decreased heart function. I understand the concerns about the rare cases of myocarditis after the vaccine, and I've treated these patients as well. Fortunately, myocarditis after the vaccine is rare, and when it does occur, it's typically mild, with chest pain that often resolves quickly. It's important to know that heart issues, including myocarditis, are much more common and more severe with the COVID-19 infection compared to the vaccine. I know that parents and families want to do whatever is best for their children, and this concern comes from a place of love. We all want to do whatever is best for our children. So let's get vaccinated. Let's fight this pandemic together and make this virus a thing of the past. Thank you, and stay safe.